Hi, Mr. Budweiser. My name is Brian Johnston. I'm going to be your student physical therapist. Over the next couple minutes, what I'm going to do is I'm going to just ask you some questions. It'll probably take about 15, 20 minutes, and then after that, we'll do some more physical things. I'll press on you, we'll do some stretching, and probably a little bit of working out. To start things off, have you ever done physical therapy?
No, I have not.
No? No physical therapy? All right. Let me confirm. First name's Jimmy.
Yes, sir.
Mr. Budweiser.
Yep.
I got age 38. And then, so what do you do for a living, Jimmy?
I'm a backhoe worker. I work out in fields, typically. I just got contracted actually to do this hiking trail. I'm pretty happy about that.
So you're out in kind of open terrain?
Yeah, but not much lately since this has been going on.
Sure. And so you spend a lot of time sitting in the backhoe?
Yeah, getting in it is the hard part, but once I'm in it, I'm pretty good.
So the sitting doesn't bother you?
Not much typically. I'm pretty comfortable with that.
And walking up on the side of the backhoe is what gets you? You said sitting down part and getting in?
Oh man, yeah, getting in and out is really what kills my knee. That's what I'm worried about. Getting back to work and actually like climbing in and out, like that's been tough.
Okay, I gotcha. Does the job involve any lifting? I don't know a lot about backhoes.
The backhoe kind of does most of the work for me. I kind of just got to lift myself in and out. Every now and then I'll have to pick something up off the ground, but not much.
No, that doesn't aggravate anything, make it worse.
No, it's mostly kind of getting in and out and things like that.
Okay. What do you do in your free time? You exercise? You do any hobbies or anything like that?
I have been trying to lose a little weight, doing some exercising, but I'll be honest with you, I ain't been consistent with it. I got some weights in my garage, but I don't get around to it much. Other than that, I might go have an occasional drink with my pals at the bar, but not much else.
So no like standardized exercise program. You just go out and lift some weights on occasion.
No, not fancy. No,
No?
just kind of working out when I can. Get some free weights. I really think that hard work is going to be what powers me through this whole thing.
Good work ethic helps. Trust me on that. Okay, so and with the losing weight, we can probably help you with that as we go along in the process. So
Cool.
we'll get around to it.
Hot dog.
And then how are things at home? Like where do you live? Do you live in a two-story? Do you live in an apartment? Do you live I don't know, in a hole in the ground? Wherever.
I do live in a trailer home. It's got a couple steps. It really sucks having to go up and down those steps every day. That's another thing that I really don't like. Is stairs, that is, especially when I'm trying to go down them. That kills me.
Okay, so down hurts more than up?
Oh yeah.
Okay.
Even in that backhoe, it's I got those handrails to go up and down the stairs and get in and out, but that don't help much. It still hurts.
Okay. All right, that's something we can work with. You say it's 3 or 4 steps just from floor to the trailer?
Yeah, about 3 or 4.
Okay.
3 or 4.
All right. And so that gets us kind of to what brings you in. I know you said your knee. What exactly?
Oh man, I'm not gonna believe this. I have some goats, right?
Right.
And one day I was feeding the goats, and one of my goats rammed into my knee. I turned around and it just hit me square in the knee, and it's just been jacked up ever since.
Okay. And I got some critters. They're fun. And so it's just the knee got butted in by the goat, so it hurts.
Yeah, I mean, I haven't really noticed much else, but right where they hit me around that area is really where it's been killing me.
So we got the right knee, front side. Anything on the back side?
Not so much, more to the front.
Okay.
Right where she squared me.
So I'm going to touch. Is that all right?
Sure.
So do we go more on the middle or on the outside? Right under the patella? Somewhere in between?
I'll be honest, which is kind of more in the front,
Okay.
inside.
So kind of between the kneecap and the middle of your leg?
Yeah,
All right.
right about in there.
I got that. Okay, you said nothing on the back?
I haven't noticed much.
All right, you can do that. What about anything traveling up on your thighs or down into your shins?
Not too much there. No, nothing.
Okay.
Nothing to speak of.
Anything on the other side? Does the other knee start hurting at any point?
Not that I can think of.
Okay. Give me 1 second. I'm gonna write a little bit of this down.
Sure. I'll check my emails.
Okay, so any other complaints for the day? No other pains, just the knee.
Yeah, just the knee,
Okay,
basically.
all right, excellent. Then right now, what would you say your pain's at? Say if you were counted on 0 is totally fine, 10 is the worst thing you've ever experienced.
Right now, I'd probably give you like a 2.
2?
A 2
Okay.
out of 10. And then that's like kind of low, right?
It is all about you and how you kind of process it. And
Okay.
so 2 out of 10 is manageable for you. I'll take it.
Okay.
Okay. So what would you say makes it worse throughout the day? You said stairs.
Yeah.
Any amount of stairs. Down is worse than up.
Shoot, I can go up and down my stairs at home, and I'll be hurting for a little while after that. But typically, it goes away after I rest it for a little bit. Sit
Okay.
down.
About how long you rested?
Probably got to sit down for maybe 5-10 minutes, and then I feel better.
And that's after just a few stairs.
Yeah, if I've been kind of going in and out of the backhoe or using a lot of stairs, and it'll take about 5-10 minutes before it to calm down.
Okay. And so say you were just going from the floor or from outside into your house, and would that cause it to flare up?
If I was
Or you
going
gotta do some
from
repetitions.
outside to inside,
Sure, that'll work.
no, not too much. I mean, I might be a little sore, but it's nothing big.
Okay, so you have to work up to it.
Yeah,
Okay,
yeah.
great. Anything else make it worse?
I can't work out right now. It's hard for me to do like squats and stuff.
Okay. And could you do a body weight squat, or is it just while you're under weights?
It hurts even with no weight,
Okay.
but I don't do that too often, so I could give you.
Sure. All right. So I've got rest makes it better. Do you try ice? Do you try Motrin? Do you try elevating? Anything like that?
I used to use some ice and Motrin. My doctor kind of recommended it to me, but once I noticed that it wasn't as swole up, I kind of stopped doing that maybe a week ago or so.
Okay. And you happen to know how much what the dose was on the Motrin? Usually goes somewhere between 200 milligrams, 800.
I couldn't tell you.
Okay.
I just scooped up a bottle at the store.
All right. No worries. Okay. When you're going through kind of your day, we want to talk about kind of the patterns of pain, when it hurts worst and when it hurts least. How does it feel in the morning?
Oh, well, it's a little stiff in the morning.
Okay.
It takes me a little while to get going, if you know what I mean.
On that scale, 0 to 10, where are we at?
Shoot, probably like maybe around a 3 out of 10.
How long does it take you to get going?
Maybe 5-10 minutes and just kind of walking around.
Okay, great. Throughout your day, just say you're doing a regular day of work. You've gone up and down your backhoe a few times, whatever's normal for you. How does it feel about lunchtime?
Like pain wise?
Yeah.
Let's say like a 4 or 5
Okay.
out of 10. It's getting up there.
All right, got it. And then what about nighttime? Same scenario, average day.
It's a tough one. Around that time, I might be already kind of resting for a little while, so I'll probably put it back like at a 3.
Okay, good. And like at its absolute worst, you've been up and down on the backhoe as many times as you can tolerate. What's the pain at then?
Ooh, that one's about a 7.
7?
That's a doozy right there.
All right. At his best, so you've been able to do what you like for the day?
I've had times where it doesn't hurt at all.
0?
Surprisingly, yeah.
Okay.
0 out of 10.
All right. I can work with that. Okay, next we'll go over your medical screening, just the stuff that you filled out when you got here.
Okay.
We already talked about your Motrin. Alcohol use, got 4 drinks a week. You just do beer after dinner. You said you drink with buddies.
Yeah, the beer usually comes in with the buddies. I don't usually drink alone.
Okay.
But that might be like once or twice a week, and I only have like 1 to 2 drinks a night.
Okay, great. Okay. We got here trauma, motor vehicle accidents, fall. Can you describe that for me?
Oh, that was the goat.
Okay, that's the goat.
I didn't know how to write that one down, so I just
That's
put
totally
it in
fine.
trauma.
Yeah, it counts. Sustained morning sickness, we already talked about that. And then so things that you want to get back to doing and that you're having some difficulty with. We got get on the backhoe. I'm totally down with that.
Yeah.
Okay. We got walking downstairs, already covered it. Walking, you're still at about an 8, so we can probably work you back up to where you want to be. All these look very, very doable and something that we can get
That
after
sounds
in the
great.
next couple weeks.
Awesome.
No red flags. I didn't see any imaging on here. Did you get any X-rays or MRIs done?
No, I don't believe in that stuff.
Okay. So at some point we might ask to do it here. I don't think it's going to be something we get to in this case, but that's something that might come up at some point. So just to let you know, that's kind of one of the tools in our bag.
Okay. Well, if the time comes, we'll see.
Yep. We'll cross that bridge when we get there. So a lot of what we're going to do is do some teaching. Is there anything that you feel kind of would prevent that? So you speak well.
Well, I haven't been in the education system in quite some time, so it's something not too text heavy, probably.
Okay. Good deal. So how does that help you learn? Do you like to you obviously don't particularly like to read to learn. Do you do, say, visual? Can I do things for you? Do you want to do them? What makes you learn best?
I'm very much so like a hands-on kind of guy, especially like at work and stuff. I like to learn by doing things.
Okay. Awesome. We can definitely accommodate. All right, and now we get down to that rascal goat. So basically, you said he just hit you from the side while you weren't paying attention.
Shoot, sucker! I was feeding him, and I was tending to his wife. And when I turned back around, he must have been a little upset with me because he hit me square in the knee, right in here. And I went down straight to the ground, and I was in pain. It hurt.
Okay, and so when he hit you, did it bend your knee backwards? Did it bend it inside? Was it just impact, and that's what hurts, or what made things hurt?
Well, I think the way I was standing, he kind of bowed my knee out this way when he hit me. But
Okay.
other than that, I don't remember much else.
Okay. And was there any kind of pop? Any kind of what did it feel like at the time?
I didn't feel any pop per se, but it hurt.
Okay. All right. And any history of problems with that knee for any other reason? I mean, you get up and down a lot, so it wouldn't be unexpected.
No, but I did hurt my collarbone when I was 17
Okay.
playing football. I don't know if that means anything.
So we'll always write it down. I think in this case it's probably unrelated, but we'll keep it in mind.
Well, you know best.
All right. And so we got things that you want to get accomplished. You've already got get on the backhoe, walking down the stairs, going for a walk. Is there anything else that you think fits in the patient goals, things that you want to get out of this?
I think just getting better is about it.
Okay, so pain reduce, because that's what you have up here on the top, is may feel better. So
Yeah,
I think that's totally in our realm here.
awesome.
All right, I think that wraps up this part. We're going to move on to the next part of the exam, and so we'll get on with it.